Hey guys, welcome to our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources and tools and tactics and review courses, videos, review books, and more to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally. We have a 99% pass rate with all of our comprehensive review courses and a 100% pass rate with our one on one sessions. I always like to give the disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis. And any of the questions that I provide are designed, I have created them based on the guidelines that are currently utilized on the ANCC and AANP exam currently, okay? And if you see any videos that I'm teaching on what we do currently in practice, I'll always say that so there's no confusion. So, with that being said, let's get into question number one for today. Now, these questions, I tried to do some knowledge based farm for you. I get a lot of requests about pharmacology is your deficit. And one thing I always say to you guys is don't make farm a separate thing to study. As you work through your conditions and diagnoses, study those medications and drug classes as you go through so that it's a little bit easier and less overwhelming. But let's hit a few little quick knowledge based ones, and I'll do this periodically so we can build that confidence and understanding on our medications, okay? So, question number one states the nurse practitioner and NP student are discussing SABAs, short acting beta agonists. All of the following are SABAs except is it A, albuterol, B, Zopanex, C, Proventil, or D, salmeterol? Tell me what you got in the comments. All right, you guys. So, stem of the question states all of the following are SABAs except. So, this right here, this stem tells you everything you need to know, right? So, we're looking for the one that is not a SABA, right? Because it says all of the following are SABAs except. So, it's albuterol. Albuterol is a SABA. B, Zopanex is a SABA. It's a short acting beta agonist, right? C, Proventil is also a short acting beta agonist. D is your answer because that's the only one out of this group that is not a SABA. That is actually a LABA. It is a long acting beta agonist, okay? Know these two your COPD, your asthma questions. Make sure you know this. All right, question number two. A patient with a sulfa allergy should avoid all of the following except the A, thiazides, B, Bactrim, C, sulfa medications, or D, amoxicillin. Tell me what you got in the comments. All right, you guys. So a patient with a sulfa allergy should avoid all of the following except A, thiazides. Yep, thiazides you want to avoid with patients with sulfa allergies. Bactrim we want to avoid because it is a sulfa med, right? C, you definitely want to avoid sulfa meds. So D, amoxicillin, you can still take, that's a penicillin, right? You can still take that if they have a sulfa allergy. That was an easier one, right? And then lastly, question number three, the nurse practitioner and NP student are discussing respiratory fluoroquinolones. All of the following are respiratory fluoroquinolones except the A, ciprofloxacin, B, gemafloxacin, C, levofloxacin, or D, moxifloxacin. Take a moment and tell me what you got, you guys. All right, so stem of the question states all of the following are respiratory fluoroquinolones except. So knowing your respiratory fluoroquinolones is the A, ciprofloxacin. Yeah, that's your answer, ciprofloxacin. Because remember, ciprofloxacin is a fluoroquinolone, but it's not a respiratory fluoroquinolone. B, gemafloxacin is a respiratory fluoroquinolone. C, levofloxacin, and D, moxifloxacin are all respiratory fluoroquinolones. And if you have not seen my other videos, I talk about that we talk about these medicines, but I always say Brittany's brilliance for this is get my lungs, thinking because we're working on the lungs, the respiratory system, right? Get my lungs, GML for our respiratory fluoroquinolones. G being gemafloxacin, my M being moxifloxacin, lungs, L, levofloxacin, okay? All right, you guys, I know this was short and sweet. Just wanted to give y'all some quick ways and things to think about with medications. Again, I will do this periodically to kind of help you get this and retain it as you are studying. But as always, I hope you found this helpful. But be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all meet me back here. And if you need any of our resources, give us a call at 803 400 6864 or shoot us an email at thenursestudio, the number one at gmail.com. We have self-paced review courses. We have our 5 week course that is about to close because I think we have two slots left for enrollment for our June 10th 5 week course. So that link is on the channel. The review book, the ebook, and paperback option are both linked in the bio of this channel. So if you're looking for any of those, just let us know. And if you're interested in a one-on-one session, shoot us an email or give us a call so we can determine exactly what you need to get you set up with all of those things. But y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all. Oh, y'all, and I will also post the nurses week giveaway winner for today later today. Okay. All right. Bye, y'all.